Hello people, this is Dr. Sahu from Revive Hair and Skin Clinic, and I'm today going to talk about crown hair transplants because this is a very common request that we get from patients across all ages, 20s to the 60s. Just going to throw some light on this topic which I'm hoping would help patients understand why a surgeon might say might advise against going ahead with this procedure. First, we have to understand that the aesthetically important areas are the hairline and the mid-scalp because it frames your face. Somebody who is very young and has started showing signs of hair loss in the crown area is very likely to progress to advanced hair loss. That risk increases if you've got a strong family history of hair loss. What you also need to remember is that the number of grafts that can be transplanted are finite. So you need to use them very economically, very wisely. And it's usually best to start working our way through from the front to the mid-scalp. And if you've got any more grafts left, then you can certainly cover the crown area. But you do not really want to be in a position where you've used a lot of your grafts to cover the crown and then you fall short of that many grafts to cover the front and the mid-scalp. Let's say somebody in their 20s who started showing thinning in the crown area went ahead, had a transplant to cover the crown or to cover their bald spot. What might then happen with progressive hair losses, that patient might be left with an island of hair in here with a halo made up of an area of extreme thinning of hair or completely devoid of hair, which would, as you can imagine, look very odd. Now consider another scenario where we might have a patient in maybe their late 40s, but the hair loss is stabilized for maybe 3, 4 or 5 years and we know it's not getting any worse. In that case, we know how many grafts we've got, we know the area of the baldness because it's not going to get any worse, and then you can plan how to use those grafts and how to cover the areas. It's always best, especially when with all procedures, it's always best to go and speak to your hair transplant surgeon if you've got any doubt. But always remember, crown hair transplant, if you're very young, might not be the best way forward. If you've got any questions for us, please get in touch with the clinic. Bye for now.